Hi, I'm Mallory. I'm going to be demonstrating a central line dressing change. Today we're working with the PICC line. So first thing, we're going to check our MAR, make sure we have the right patient and the right order, which we do. Patient Jennifer Doe, order for a dressing change. MAR says she doesn't have any allergies, which we'll confirm when we go in the room. So I'll go ahead and knock on the door. Hi Jennifer, my name's Mallory. I'm going to be doing a dressing change for your central line today. Does that sound okay?
Yep.
Perfect. So I'll go ahead and provide for privacy and wash my hands. So first thing, Jennifer, can you give me your name and date of birth?
Jennifer Doe, 11/5/75.
Perfect. And that matches my MAR as well as her ID band. And do you have any allergies?
Nope.
Okay, perfect. So we're good there. Once again, just verifying we have the right patient and the right order, which we do. So we'll go ahead and get started. First thing, Jennifer, we do ask our patients to wear a mask during this procedure. Do you think you would be able to tolerate wearing a mask for a few minutes while I do the procedure?
Absolutely.
Okay, perfect. So I'll go ahead and either give that to her or help her put it on. And then I'm going to go ahead and open up my sterile field here. Things wouldn't normally fall out. And grab out the mask and put a mask on for myself. Okay, so now that I have the mask on, I'm going to wash my hands again and put on some clean gloves. And first thing we want to do is assess our insertion site. We're looking for any redness, swelling, bruising, anything that might indicate a problem with our insertion site. So far everything looks good. We also want to palpate, so we're going to make sure we touch around the insertion site. And Jennifer, as I do that, is that causing you any pain or tenderness?
Nope.
Okay, perfect. So insertion site looks good. We can also take a look at our catheter, make sure there's no holes, kinks, anything like that. Next thing we want to do is we'd have a measuring tape. We're going to go 6 inches above our insertion site, and we want to measure the circumference of the arm. We're also going to measure from the insertion site to the end of the catheter, and basically any deviations within any deviations of a 1/2 inch or greater could indicate that there's a problem with the circumference and the length of the catheter that's exposed. So in this case, both of those findings are close enough to the previous assessment that I'm not concerned about that. So we will go ahead and start removing the dressing. So things to remember is you always want to go from the outside, moving your way in, and you want to stabilize the catheter as you're pulling up on the dressing. Okay, so once we have the dressing off, we're going to take a look if there's any drainage or anything like that. In this case, there isn't anything. So we'll go ahead and discard that with our gloves. And I'll wash my hands. We're out here. Once I've got my hands washed, the next thing I want to do is open up my sterile gloves. So I'm going to go ahead and just be very careful, just pull out the gloves here. And now that I have sterile gloves on, I can touch anything within here that I need. So this is our tegaderm. We won't quite need that just yet. This is an extra drape. You can use it to put under the client if you feel, and maybe under the arm in case there's some drainage or anything. We're good in this case, so I won't worry about it. So first thing I want to do is grab some alcohol pads. And I'm going to clean the insertion site, making sure to keep my hands above my waist. And cleaning the insertion site with the alcohol swab, you want to start at the insertion site and work your way out in a circular motion. And this is really just to get rid of any excess dried blood or any drainage that might be coming out of the insertion site. So again, working our way out in a circular motion, and then we can throw that away. Next thing you want to do is grab our CHG cleaner. You'd crack this, and then the trick with this one is you just want the friction. So we're going to go in horizontal and vertical motions using for about 30 seconds, and we want to use as much friction as possible. I'm going to go ahead and just stabilize that while I do this. Making sure to clean under the hub here. Making sure this area is nice and clean. And we can discard that in the trash. The next thing we want to do is use our skin prep. We're going to do that. Basically, we're making a window outside of our insertion site, making sure not to touch our insertion site, obviously. So I'm just going to stabilize the end of this catheter here because it's slipping. But you would draw a window on the outside here, and essentially that's just to help the tegaderm stick. So while we're waiting, this is sort of falling, okay. So while we're waiting for that to dry, you would throw that away. While we're waiting for that to dry, we can get our tegaderm ready. Actually, you know what? I'd probably remove my gloves at this point, my sterile gloves. While I'm waiting for this to dry, I'm going to go ahead and take my sterile gloves off, put them in the trash. I'm going to not throw those away. Wash my hands. And put on clean gloves. Which I only have one up. There's one more over there. Okay, and one lifespan consideration that I forgot to mention before is as you're pulling the dressing off, if it's an older person and they have really frail skin, you can use an alcohol swab to kind of help release the adhesive on the dressing. That way you don't cause any skin tears or anything for that fragile skin. So with clean gloves, I'll go ahead and take my tegaderm. Grab it out, and now that everything is dry, and we will go ahead and just place this. We want to make sure that this little hub and the insertion site are within the window. And then we can pull that off. And we do have some tape here as well. This would go in the garbage. We do have some tape here as well. You can use this tape for a couple of things. One would be to label the dressing with my name and the date and time that it was replaced. And then also to put extra secure on our site, on our dressing, just to make sure that the catheter and the hub are not moving around too much. And I'm just going to verbalize that. So you would use a couple extra pieces of tape to really secure that and make sure that nothing's flailing around, and that way we don't risk it falling out or being pulled out. Once this is all done, we can remove the mask from our patient. Did you do okay, Jennifer? Was that all right?
Yeah, that wasn't so bad.
Okay, great. So I'll remove my gloves and I'll wash my hands. And I'll remove my own mask and probably wash my hands again. So then lastly, I just provide for comfort. So I'll make sure the bed is low, call lights in place, make sure the client tolerated it okay, see if there's anything else that she needs. And then I would unprovide for privacy. And then lastly, I would just document the date and time that it was changed, how the patient tolerated it, any assessment findings. And I think that's it. And that's how you change a dressing on a PICC line.